Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 761,226 confirmed cases of COVID-19 in Canada and 260,370 cases in Ontario. Chatham-Kent has 1,139 cases, and Sarnia-Lambton has reported 1,790 cases. Michigan now has 554,237 cases, with 28,439 cases being in Detroit. Today we are reporting 53 new cases of COVID-19 in Windsor and Essex County. 9 are close contacts of confirmed cases, 12 cases are related to outbreaks, 6 are community acquired, 1 is travel related outside of North America, and 25 cases are still being investigated. We have had 11,968 cases since last March. 10,843 people have now resolved, and 821 people are active cases at this time. 92 confirmed cases are currently in the hospital and 12 people are in ICU. We are reporting the death of a gentleman in his 70s who lived in the community. Our community has lost 304 people to COVID. 204 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 48 active outbreaks in Windsor and Essex County. 26 outbreaks are in workplaces. Right now, we have several farms in outbreak, but we do have 48 cases that are currently active in the farms. We have 17 outbreaks in our long-term care and retirement homes, and in these outbreaks, we have 157 active cases at this time. And we also have 5 outbreaks in our hospitals. As you know, second round of vaccinations for residents, staff, and essential caregivers of long-term care homes will begin tomorrow. And despite the rollout of vaccine, we all must continue to follow public health measures. Stay home if you're sick, limit your close contacts to household members, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID exposure app at canada.ca. If you have any symptoms of COVID, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As we continue to see the cases stabilizing in our region, we want to make sure that all symptomatic individuals, positive cases, and their close contact follow public health directions to ensure that cases are contained and there is no ongoing risk to the community. We all have to do our part and stay home when we are sick or when we are identified as a close contact of a confirmed case. Today, I'm issuing a class section 22 order for all persons residing in or present in the city of Windsor and Essex County who are identified as a person diagnosed with COVID-19 or have the signs and symptoms of COVID-19 and have been tested for COVID-19 and are waiting for the result of their COVID-19 test results, or otherwise have reasonable grounds to believe that they have one or more symptoms of COVID-19. And last point, if they are identified as a close contact of a person diagnosed with COVID-19. I am ordering these individuals to take the following actions effective 12:01 on February 1st, 2021. To isolate yourself without delay, remain in isolation until the expiry of the required period, and during the self-isolation period, conduct yourself in such a manner as not to expose another person to infection of COVID-19. Keep away from vulnerable person and inform VICHU if you require any necessities or additional medical care. Provide Windsor-Essex County Health Unit the names and contact information of close contacts during relevant dates immediately upon request. Number 7, follow any further instructions provided by Windsor-Essex County Health Unit pertaining to COVID-19 and the terms and conditions of this order. Number 8, seek prompt medical attention if your illness is worsening, for example, difficulty breathing, by calling 911 and mentioning your COVID-19 related diagnosis or symptoms. This order will be posted later today and will be enforced starting February 1, 2021. The order will be translated in French, Spanish, Arabic, Low German, and Chinese, and will be posted on our website as soon as possible in all these different languages. Thank you.
We'll now take questions from the media. We'll start with CBC.
Hi, good morning, Doctor. I'm wondering if you could get into a bit more the reasons why you're imposing this order today.
So the reason for this order is, as we know, our region has been dealing with COVID-19 for quite some time now, and in most of the instances, almost 90%, 95% of the time, the individuals are following these guidelines. They are isolating immediately while they're waiting for test results, and or when they are identified as a positive case, they stay isolated, or when they're identified as a close contact. There were some rare instances where we learned that the individual basically dismissed the diagnosis and continued to stay outside, and by the time when we are following up with them, it's already too late, and even if we issue the order at that time, it doesn't do much good in terms of issuing an order after the fact. What we are struggling with is often at times when people are sick, they go and get tested and they were advised to stay isolated. But while waiting for their test results, they're still out and about and doing things that they normally would do. And then last but not the least is the close contacts. They are also required to self-isolate to prevent any further spread. And as we see that the cases are going down, so in order to keep it that way, it is really important for us to make sure that all these cases are contained in the best possible way, especially when we are talking about the new variant of COVID that is affecting in some of the communities. So far, we have not seen any documented cases of that COVID variant virus, but once it starts, we know it will spread quickly. So having this order in place, it sends out a clear message to the public that what the expectation is. It would allow for enforcement if there is any violation.
You mentioned a few days ago that the health unit would be looking to declare many of the outbreaks at seniors facilities over. I'm wondering if you're still on track to do that.
So I'll pass it on to Teresa.
So we, a lot of our outbreaks will be rescinded next week. So we anticipate that next week we'll see a lot of resolution of all of these outbreaks. So right now we do have 17 outbreaks in long-term care and retirement homes. We know that there are still 157 active cases throughout all of those homes, and that's including residents and staff. So there will be, I think, again today, there may be one or two that'll be rescinded today, and we'll see more progress over next week as well.
Thank you.
Any questions from Blackburn?
Yes, good morning. So just regarding this order, did you find that you just needed another tool to enforce these things? I mean, these things sound like things that we've been hearing now since March.
Yeah, no, I think as I said, some of the reason is we want to make sure that we don't get into the same situation when people are, even if it's few, if they're ignoring the order, we will be in a position where we start to see community spread again. And adding on top of that is the variant of concern that some of the other regions are seeing. So having this order in place would help us to give out a clear message and allows us for any enforcement if necessary. Our teams are pretty much on top of contacting and reaching out to do all the case and contact investigation. So we do have all that information, and all these individuals are getting contact in a very timely manner. So we don't have any concerns from any delay on public health providing them with the instruction. So this order will come into place when you are provided the instruction that you must self-isolate. Whether based on your symptoms, whether you based on the fact that you are identified as a close contact, or based on the fact that if you are sick and you're going to and you're waiting for your test results at this time. So we do hope that this tool will allow us to do a better case containment in the community, so we don't get to the point of having widespread community transmission again.
So what would enforcement look like? Is this going to be extra calls to make sure people are isolating like they've been told? Or are you looking for people to call and like notify you if they know of somebody who's not isolating as they should be? What will the enforcement look like?
Well, we definitely will be doing our follow-up with all these cases and contacts as we normally do, and then if identified as a concern that that the individual is not following these precautions, we will take action. The ability for us, our inspectors, to issue ticket will be there based on the directives and based on the order, and even though we recognize that there may be people who are aware of others, we want to be very careful with that because of the privacy and personal nature of this information. We don't want to set a precedent when everyone starts to call without even knowing if the person should be self-isolating versus not. So there's this fine balance, and we hope that people use this really carefully. And use it more as an educational tool rather than an enforcement tool. We do want people to comply voluntarily. It's not the intention to start issuing ticket. It doesn't benefit anyone. I think it's just about sending a clear message with some potential consequences if, despite those messages, if people are intentionally not interested in following the public health guidelines. I think that's the key piece. The intentional piece, and if they are aware and if they still refuse to follow, then there is the ability to act immediately to contain the virus.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Doctor, were there no penalties for violating self-isolation while awaiting test results up till this point on the provincial level?
There are tools available, but again, all of these tools is not, I guess, cannot be enforced as quickly as we'd like to see. So for example, if the order is not there, if someone violates that order, violates that recommendation that you must self-isolate, we can send some enforcement and education to them, giving out the clear message, or even issuing an order at that time. And then we would expect that if they fail to follow that order, then they will be charged. Having this class action order in place, it basically already puts them on notice that if you violated, and if we have evidence that you violated that, you will be charged. So that's the intent.
And why now? Why not several months ago, just after you made this announcement this morning? I did a quick search and I see other medical officers of health, not many, but others had invoked this order or similar one several months ago. Yeah,
and so there's a pros and cons to issuing this order, and as I said, it's that fine balance that we want compliance. We don't want people to stop going into the testing site just with the fear that, oh, if I go to the test site, then I'll be in that order to self-isolate for 14 days until my test results come back. So might as well, I don't even want to go to the test site. So we didn't want that. We want to make sure that at least those people who need the testing can go there and get tested without the fear and concerns that they may be forced to stay home, even if they choose to, be safe and be healthy and get tested. So there is this fine balance that we want to make sure that we are not pushing people or driving people away from testing or following up with public health. We want their compliance, because that's the only way we would be aware of the disease. We would be able to trace, track, and isolate. So that's the intent. Right now, the timing is because as we continue to see a decrease in the community cases, I think that everyone has realized that how important it is to bring the case counts down, how it impacts our society by having all these lockdowns and closures. And we feel that on top of that, it is also important that people understand that it's not a choice that, even if I'm sick, then I can go and do whatever I need to, especially if we start to see any of the variant virus here in our community. Because if we start to see a case of variant virus in the community, and then if individuals are not following, it can easily lead to hundreds and hundreds of cases, as we have seen in other countries, especially England. So we don't want to go there. So having those reasons in place and finding that right balance of getting the compliance, as well as ensuring the spread, containing the spread of the virus, we feel that now is the right time, at least, to issue the order and get compliance from the public.
So in part, like you're saying, it's almost preemptive of anticipating the arrival of that more highly contagious variant?
That is correct, Taylor, yes.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, sorry, just a little confused here, basically off Taylor's questions and Maureen's questions. So if this was already in place, so I just want to make sure I have it right. So just say someone in the community tests positive for COVID, you're just stressing the importance of self-isolating?
That is correct, yes, because as I said, there has been some instance where we were aware that, very rare instance, well, let me just be very clear, where there were some rare instance when we were aware that someone violated their isolation requirement. And I can still remember, because when it's fresh in my mind, when someone failed to disclose or don't want to disclose their close contacts. They just basically said they don't want to talk to us. And that resulted in issuance of an order at that time. So with this order, all of these would be a requirement. It's not a choice that you can say, I don't want to disclose my close contacts to you. You have to, because it is important from a case and contact management perspective. Also, if they're identified as a close contact, we want to make sure that they complete their 14-day self-isolation, because it's also important that these individuals, if they develop a disease, whether symptomatic or asymptomatic, they do not pass it on to anyone else. So that's why it is the intention that we make it clear for the people to follow these recommendations. I hope I answered your question.
So like in the past, there was some that did not want to share their contacts or where they went to. So now they would have to share all those details?
Under the order, yes.
Okay, thanks for that clarification. I know some of your orders, you have an end date. Is there an end date on this one, or is it hard to say an end date?
So the order right now, it's I think we'll have to look at the end date. I anticipate that this order would be in place at least for 3 months, and will be reconsidered and reevaluated based on the applicability of that.
Thank you.
Any questions from CTV?
Yes, good morning. So what are the penalties for not following the order?
So under the order, an individual can be charged up to $5,000 as part of the Section 22 order. There are other provisions under the Reopening Ontario Act, which allows the bylaw officers and others to use the Section 22 order to charge individuals under the Reopening Ontario Act as well. So it just basically gives more tool for enforcement.
Okay, so will there be more enforcement necessary, more bylaw officers needed to see this through?
I don't anticipate that because, as I said, these are all rare instances, but we wanted to make sure that this is in place already. And as I said, there are not many people who are violating these recommendations. These are very few, maybe once a month we come across with a situation, or maybe more than once a month, maybe a couple of times, that we want to make sure that the message is clear. And when we know, when sometimes people see that there's penalty attached, they're more serious in following the recommendations rather than just saying whatever they need to and then go on and do what they would otherwise do.
Okay, thank you.
Any additional questions from CBC?
Yes. I recognize that the hospital is doing vaccinations for workers with the Pfizer vaccine, but overall, we've requested the number of healthcare workers who have received the vaccine several times, but we haven't really received an answer. I'm wondering if the health unit is aware of how many healthcare workers have refused the vaccine so far and in which facility. And if not, how can the safety of patients in those facilities be assured? How can the safety be assured without a sense of who's been vaccinated and who has declined the vaccine?
So your question is specific to the healthcare workers in these long-term care home and retirement home, is that correct?
Well, I was hoping for an answer for hospitals, long-term care homes, all healthcare workers if possible.
Well, so what I can tell you about our, from a safety perspective, obviously from a safety perspective, the priority that's been identified by the ministry is the residents of a long-term care home and retirement home. And they are covered for the most of the part. So that's the critical piece. When you're talking about the safety of who, the safety of the healthcare worker or the safety of the patient that they serve?
Patient safety.
Patient safety. So patient safety is always put in place based on all the infection prevention and control measures that are in place. And having a vaccine doesn't change any of those infection prevention and control measures. And as more and more vaccines come in, there is this, there will be vaccination of all the healthcare workers, depending on the level of risk that they are exposed to. And again, the level of risk would be determined based on the people they serve and based on the type of interaction that they are having. There will be an interaction with all the appropriate personal protective equipment with appropriate physical distancing. Those would be considered as a low risk encounter versus a situation where there is inability to wear the personal protective equipment, inability to maintain physical distancing, and in an uncontrolled environment. So you will see the range of risk for all these healthcare workers that would be considered when they will be prioritized based on their vaccination need. Right now, we already know that there's a shortage of vaccine across the country, and these vaccines are now prioritized to the most vulnerable who could potentially die from if they contract COVID-19 virus. And those are our seniors and elderly, and they are protected. As soon as we get more vaccines, we will be moving forward through our prioritization that's provided by the province, as well as a local prioritization committee that's working on developing those sub-prioritization strategies to ensure that everyone, first of all, who is at a higher risk of developing more severe complications of COVID-19, they will be protected. And then the ability for others to get the vaccine based on the level of their exposure and their ability to pass it on to someone else will be protected.
Thank you, Doctor. But are there any numbers of healthcare workers who have refused the vaccine?
Okay, I'll pass it on to Teresa.
So I can speak about our efforts with Moderna. So we're doing the long-term care and retirement homes, and as we go back in to give second doses to everyone that received their first dose, so that would include residents, staff, and long-term care, essential caregivers. And as we go, and as Dr. Ahmed said, we do have, until we receive better regularly scheduled vaccine supply, we have to monitor and manage our supply of vaccines right now. So we do know that through our numbers and our calculations and our work with all of the long-term care and retirement homes, that there are about 400 residents that have not received their first doses of vaccine yet, but intend to receive the vaccine. So whether they're related to an outbreak or were too ill at the time, we still have those people remaining. As far as staff, we also know that we have approximately, based on our records only, about 1,000 staff members in long-term care and retirement homes that have not received the vaccine yet, but intend to. So they're not refusals, they have just not had access to the vaccine. We also know that there are approximately 700 essential caregivers that have not received the vaccine at this time in long-term care and retirement homes that also would like the vaccine. So once we're able to offer the vaccine to everybody, first and second doses as we get as we move forward with second doses, but also be able to provide first doses to everyone in the long-term care and retirement homes that want them, then we'll have a better idea from our point of view. And I know you're asking about the healthcare workers that were provided Pfizer through the Pfizer clinic through the hospital, and I don't have those numbers, and I don't have refusal, because I don't think everyone that has been, I don't think everyone that wants a vaccine as a healthcare worker has received the vaccine.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, Doctor, about the order, you mentioned symptomatic residents now under the order are required to self-isolate, as has been the recommendation all along. Can you reiterate how this will be enforced? I know that you don't want to penalize people, but what will be in place to make sure that the people who just don't want to self-isolate are actually doing it?
So for example, if someone is identified as a person diagnosed with COVID-19 and upon other investigations because if you recall some of our cluster investigations, we do come across with these connections when people identify, oh, I had a contact with Mr. Smith, and then when we are trying to put that Mr. Smith in our file, we already know that Mr. Smith is positive and Mr. Smith should have been self-isolating right now. So what's going on? So those type of investigation, when we come across those type of situations, we can immediately act on it and maybe issue a ticket at on that instance. Same idea if there are people who are waiting, who went to the assessment center symptomatic and was given the direction that you should wait until we get your test results back. And if we are calling them and they are out and about, there was an instance where I'm aware that an individual, while waiting for their test results, was with friends outside, not home. Those are some of the instances when we see that this is something that's there. We do have the ability to issue any ticket. Or if they are identified as a close contact and we have already said that, yeah, well, you should stay home. And even though all close contacts do not necessarily convert into positive cases, but let's say it unintentionally, if they pass it on to someone else, and then the same close contact is identified by another person on a different day, saying, yeah, I had this contact with this person. So that information is already with us and we will be enforcing it. So those are all the direct enforcement that we will do. And obviously sometimes some of these complaint-based investigation we also do. But again, I don't want this to be used as a complaint-driven approach. It should be more on our investigation-based approach and ensuring that people do the right thing. And as I said, there are very, very few people who have actually done that. And we want to make sure that we have the tools to act on it quickly, and the timing is the key. As if we want to really contain the virus, the timing is the key, and making sure that especially if a COVID variant arrives here, people are doing their best to contain the spread as quickly as possible.
And you may or may not have said this sometime over the past many months, but while somebody is waiting for their test results, or if they are a close contact in either of those situations, is the health unit calling them regularly? Or, for example, somebody waiting for a test result, do they just get the call when the health unit gets their positive result back?
So generally speaking, if people are waiting for the test results and if they're not positive yet, we don't necessarily call them because that number would be really, really high. There are more than 1,000 tests that's done in the region, so we can't possibly call all of them. We only call when we get a positive result, and then we do the investigation.
And somebody who is confirmed close contact, how regularly are they contacted by the health unit?
So they are initially contacted at the time of identification, and then they are called on day 7 and day 14, just to make sure that they do not develop the disease, and if they need any support. And in the meantime, they can call us anytime if they start to exhibit any symptoms, and if they need any assistance, they can do that. But from the health unit side, they are identified, they get a call once they are identified, and then they are called on day 7 and day 14.
Okay, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Okay, thank you everyone. Have a great day.
Thank you.